As COVID-19 cases rise, Philadelphia officially reinstated its mask mandate today, requiring residents to wear masks in public, indoor spaces, and businesses. The city of brotherly love is now the first major city to reintroduce mask requirements since most local governments lifted them earlier this year. Meanwhile, new White House COVID czar Dr. Ashish Jha is signaling the Biden administration is staying out of the way and allowing local officials to make decisions on COVID restrictions.
Local officials do have a lot of local knowledge of where is it spreading, in which communities. They're using other types of data. So I have been really supportive of local local leaders making local decisions, mayors and governors, and I continue to be supportive. I think that's the right way to go. I don't think it's useful for those of us sitting in Washington to second guess those decisions.
Joining me now, Dr. Kavita Patel, MSNBC medical contributor and former White House health policy director under President Obama. So, Dr. Patel, what is your reaction to this shift we're seeing from health officials who are leaving protocols to prevent COVID to local officials and to individuals? Is that smart?
No, it's not smart, Zerlina. I cannot help but have the Fleetwood Mac song in my head, like "Go Your Own Way," and that is absolutely not working. Why? It can work when you have thoughtful public health leaders, infrastructure, funds to actually get leadership together in the community. Philadelphia is a good example of that. And they were very public that, listen, we're going to do things differently because our people have been discriminated. And guess what? We're not going to wait till they get further discriminated to get access to prevent illness. But what do we have in states like North Dakota, states like Texas, places that don't have that infrastructure, are barely reporting COVID cases, Zerlina? What are we doing to protect places like that? Go your own way, let local officials do what they need to do. That actually kind of takes away what I think is really a moral responsibility of a public health infrastructure like the White House, like the CDC, like the FDA, HHS, and just abdicates it to maybe a good set of people, but in many cases in our country, zero attention to these issues.
It's so frustrating because I feel like, I don't know when it happened, but there was a shift that took place. Yeah. The beginning of COVID, it was like, don't get COVID. Yeah. You don't want to get COVID. Right. Try to prevent COVID infections. Now we're like, right. Oh, it's only this many cases, and they were mostly not severe cases. We've moved away from preventing COVID to preventing severe cases of COVID. Is that smart? Yeah. Because for me, that feels like an abdication of the public health responsibility, as you put it.
I agree, Zerlina. So two things that I have an issue with that. By the way, I went kind of backwards and looked through history to understand like what's going on, because I feel like you did. All of a sudden I woke up and everyone's like, I'm done. We're done. We're just going to go back and live our lives. It's actually like normal, these 2-year cycles kind of in the early 20th century with the pandemic flu. After about 2 to 3 years, the world was like, we're done. So I do understand the emotional behavior that's happening, but the lack of the health follow through. And here's where the rub is. If you have gotten your vaccines and your boosters on time, and if you get a breakthrough infection and can get access to one of these treatments, a pill, monoclonal antibody, viral treatments, then you are likely to have either a mild illness, you didn't need anything, or prevent you from going to the hospital. But Zerlina, that's too many ifs and buts and hopes and prayers that I would have on a health system that is really at its brink and not doing great. And then a public health infrastructure where, again, go your own way. That's the theme.
So one of the things that I've done since the beginning of the pandemic, and I'm still doing, is wearing my mask when I'm in public settings. Yeah. I mean, you know, my dad is big. I mean, he's just like, I'm not taking this off my face. It's N95 from the day one, and I'm not moving this mask. I mean, should we all be wearing masks in public settings, even if they're not mandated?
So I think it depends on the type of public setting. I just want to say this because I know people get confused. Outdoors or high ventilation, you know, open air, coffee shops, restaurants, those are incredibly safe, where you really probably don't even need to wear a mask, especially if the person you're with and you know that they're not immunocompromised and they're vaccinated. That's a safe setting. When you're indoors in crowded spaces, I wear mine, my kids do, we're all vaccinated, we're all boosted. And I wear that inside of spaces because, Zerlina, it's too close for my comfort. And here's what I'm trying to avoid. People are like, you can't avoid an infection. I said, there's too little I understand about long COVID. And there's too little I understand about whether I'll be lucky and I won't get more sick and have to go to the hospital. And I don't want to take that chance right now. Talk to me in 5 years. Maybe I'll be okay with it, or 2 years. But right now, I think it is okay to be prudent, and we shouldn't mask shame. And we should also be very aware of the people around us and how they might feel more comfortable if we're wearing a mask.
I feel very validated right now because I'm like, I'm afraid of long COVID, so I don't know when that became some sort of ancillary concern. That's like a real concern. Yeah. I do not want any of those things that are associated with that. We only have 30 more seconds. Are we in a surge right now? I can't figure that out based on all the things I'm reading.
Briefly, we're in an uptick. Whether it constitutes a surge and we get to where we're overwhelmed, I don't think we'll get there. So our health systems, hospitals, we will stay at capacity and won't exceed it. But we are seeing an uptick in cases. It's going to cause some communities to have to rethink some of their decisions and mandates.
Dr. Kavita Patel, thank you as always for being here, and please stay safe. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.